everybody. It's Matt from Ok Aussie, and that's Dyan who's just hitting me on the head. You saw her do that, didn't you? That's the third time she's hit me on the head. It's okay. She's in a pain response at the moment. She's not doing too well. What? You want that bit? Alright. I have actually just swung her around and actually dropping the legs lower because I'm just actually trying a different circulation thing because she's losing circulation to the feet. The feet are in lots of pain because she's also been able to trying to counterbalance things. She's actually had her feet elevated because of the increase of the spider veins, the reticular veins and the varicose veins that are developing. So the counterpoint to that is putting your feet up. Well, that's not helping her circulation. With the blood pressure that's not there. So I'm rubbing her feet. I'm so sorry you're in pain. Now, we're also at very high risk of seizures, and pain responses are a major trigger to that. So just stick around. I don't know what's happening at the moment. Are you okay with me? Are you still cognizant? I am rubbing your little footsies away at the moment.
Just hit him hard with a hammer.
I'm not going to hit your poor toes hard with a hammer.
Cut him off.
I don't want to cut them off.
Cut him off.
Do you have pain anywhere else?
Lower legs, but not as much as my feet.
Okay.
My feet.
Your feet. Do they feel cold?
I can't feel much.
No.
It's just weirdness.
They're actually not cold, they're warm to touch. You've actually had socks on. I've taken the socks off just so that I can rub them. You got a good blanch response on the feet. Why would you do that?
Sorry.
You're not sorry, you done it. Fourth time. Did you see that again? It's dangerous being a carer. Make love, not war.
Do you know how much you're hurting me?
What?
You tried to bend my shin in half. You can't bend shins in half.
No, you cannot bend your shin bone, your tibia, or your fibula. No. She's saying that because we swung her around to put her legs below. And of course there's a little rail on the side of the bed, so...
He was inconsiderate.
I just swung you around.
Bend my leg like it's
sometimes we forget Dyan's not constantly aware of what's around her.
Of course I don't know what's around me. All I can think of is
run your little feet. Run your little feet. Go. Feet run. Run. Run.
God, there's
Run.
no energy in them.
It's been very tired. It's an exhausting day today. Okay. How's the rest of your body feeling?
My feet hurt like...
But nothing else?
Oh.
You don't have any nausea?
No.
Okay. You don't have any headache?
No. I feel like this pain's going to make me pass out.
Okay. You don't have any chest pain?
No, I don't.
Okay. Do you have any difficulty with low breathing at the moment?
Only because of the pain.
Okay. So just purely a pain response. Alright. Is this rubbing helping your feet?
Yes.
Okay. Is there anything else that you think that we could do that might help your feet?
I don't know.
I don't know. I'm rubbing fast. I'm rubbing hard.
Pull that pinky. Face. All of the pinky.
I'm pulling your toes.
Just each.
No, I hope your day's going really well. If you're new to the channel, welcome. This is Dyan.
Bad day.
Dyan's got 22q11.2 deletion syndrome.
Bad day.
Chromosomal disorder, by the way. It basically means that she's missing a deletion, microdeletion, on the long arm of the 22nd chromosome. We've got 23 sets of chromosomes, by the way, in each cell. And with that, it means she's missing about 40 to 60 genes. I know, right? Now, circulation, heart. She's had a cardiac event, heart attack in March. She's got massive edema, about 3 kilograms of fluid weight put on, which she can't get rid of. That's why she's in the crucial mode. She has seizures regularly, so that's a concern. Heart rate is fluctuating. Resting heart rate's 52, but it goes anywhere from as low as 34 all the way up to 199. Let me do some squeezing.
This side, whatever that's
Right side, she's got dyslexia, so she doesn't know left and right. Dyan is autistic, ADHD, OCD, Tourette's, seizures.
They're both right.
GI trait. Everything's right if it's right, honey. Just remember that. And that's because 22q is an overarching and umbrella term for all of his sub-conditions. In fact, most people with 22q, I'd say it's about 40 to 50% of them will have ADHD, about 25% will have autism. Many of them will have autoimmune, GI tract related issues, skeletal problems, cleft palate, a whole range of stuff, especially neurological. Where are you going? Is the pain getting anywhere? Do I need to give you some pain relief? Topical pain relief on your toes. I can give you some cream. I can give you some oral pain relief.
I don't know what kind of this.
See, circulation wise, this warming action of rubbing should get
Nothing's
stimulation.
working. Like every time you stop, it just goes back to square one.
Okay.
Oh my god, I can't deal with this level of pain.
Right, we might have to give you a couple of things to help you with that level of pain. You want to swing around?
I don't really want more drugs.
Say no to drugs, kids. But sometimes drugs are needed when your body can't handle the pain. And if you can't handle the pain response, you might pass out with symptoms.
What kind of pain
Medicinal
is
CBD,
this
but I can give you some
for?
cream. I don't know. I'm thinking it's more circuitry at the moment.
It is.
That's why I've got your legs lower, because I'm just trying to get the blood flow coming now for a little bit. You do make a lot of noise. It is a bit hard. Sometimes the Tourette's will kick in, sometimes the coprolalia. So that's the bad words, this weren't the inappropriate stuff that you shouldn't be saying. Echolalia, that's like a parrot. Speaking of parrots, we actually have two of those. They're up there. They're watching very closely what's going on here. How are you going? Still with me?
Yes.
Good. Why does your eyes look a little bit like they're rolling back out of it?
Because it's really hard to handle the pain.
Alright, I'm going to get you to swing back in bed. And we're going to get this a little bit better sorted for you.
Ow, are you going to get my life sorted for me?
Oh, God knows how I'm going to
I
do
don't
that.
think it's possible.
I don't think it's possible
Oh,
either.
my feet.
Let's give you some topical cream, though, just maybe that helps.
Which one?
Good question.
Just wanna chop
Ketoprofen. We're going to
my
give you some
feet off.
ketamine on the feet.
Can we chop my feet off?
We don't want to chop your feet off. That's not much fun at all. Where on your feet particularly do you feel
The
the pain?
whole thing. The whole thing.
Okay,
Both
well,
feet.
that narrows it down a heck of a lot, doesn't it?
Where's
Not.
my socks? You can't not put my socks
Hold on, let me get you some socks.
Oh.
So it is Thursday the 10th of the 10th. It is currently 5:15 now.
Oh,
This is the witching hour. This is the time frame that I hate the most when it comes to neurological events for Dyan, because from 5 o'clock through to 6:15 is the most threshold likely period of time for having neurological things going on. We find that out because she's in. What's your arm doing? Dyan, are you with me?
Yeah.
Okay, so you're doing some neurological weird stuff at the moment as well.
Oh, my feet.
I know you got some pain response. How do we differentiate? How do we know the difference? God knows. Well, I hope God knows, but I've got to try and work that out with a person who's autistic, who's got interoception, an inability to be able to communicate.
Me.
Great, you got a pain response somewhere else other than your toes. I could try kicking you in the knees, see if that helps. Okay, this will give you something. This is a topical ketamine, so this will give you something nice. Love the noises that she makes. I might have to give you.
Sock.
Okay, one sock. You and your foots.
I can't handle with no sock.
I
Crap.
cramp where?
Nah, just before you about it.
Okay, let me just get this issue. Cramps. You could have some electrolyte issues going on here. Not enough
Yeah.
salt. Going with GI tract related stuff it's been having. Young has got gastroparesis, and obviously with the GI medication she's been having, it can change out. It's gone?
I think so.
Okay, cool. I'll put some ketamine on now. I was just applying some direct pressure to the cramp.
Especially the little toe, please.
Okay, little toe coming in. This stuff goes a long way and will give you some good relief, I hope.
Oh, please do,
We have got
please
a
do,
massive
please do,
medical
please
cabinet
do.
of so many wonderful things for so many different weird and wonderful things, because we've done having that 22q, also having EDS, which is loss down loss, hypermobility.
Little toe. Oh, you're
Then
so
circuitry.
horrible to me.
No, would you?
Use my toe.
Take it back.
My little toe is horrible to me.
Okay, your little toe's naughty then. Alright, I've got cream saturated across all those
The
points.
piggy didn't go to the market and stayed home.
Okay, there's your sock. Damn that
He
pig.
stayed home and he's hurting me.
Okay,
Ow, you caught me on cotton.
okay. Cotton on, cotton off. That should
You
be a
should
brand.
not be trusted with babies.
Okay. I've just got to wash my hands. I am going to give some pain relief. just going to give you an earlier dose of medicinal cannabis. Now we have Google Home Automation that has everything scripted as to what time we take medications throughout the day for Dyan. With these pain events though, they can be, as I was saying, a nasty trigger into a neurological event. Again. Yep. Now, medicinal CBD, it's 10-10 combination of THC and CBD. Very good from everything from inflammation, pain, nausea particularly, helps with seizures. Some of the other actions you've seen, so we've just seen some rapid clap actions, we've seen some of these. So we've got a few other tics, which is more on the Tourette's side of the neurology for Dyan. Let's again hope that nothing else escalates into this.
Paging Mr. Spock.
Okay, so sorry, I was just at the medical cabinet getting
Paging
evening
Mr. Spock.
medications ready, just in case I need any of those earlier on.
Spock.
Now, speaking of which, what's happening with you, Miss? What are you feeling at the
Paging
moment?
Mr. Spock. My little toe.
This little toe went to market, and this little toe went all the way home.
What are you doing?
Well, unfortunately, there is...
Just sawing the feet and legs.
I know, right?
Being dramatic.
I know, right? And why am I being dramatic?
No, we're not doing that.
Oh, yeah, we are.
No.
Yeah.
Look at the pretty hummingbird.
Hummingbird, la 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 la, no.
Please
I
stop.
just need to see what your results are.
Rub that little
I'm going to rub it,
toe. It's
and I'm
being
going to put this on.
stubborn.
I'm just putting the pulse oximeter onto Dyan so that we've got an idea of heart rate and breathing in case anything goes pear-shaped.
Nobody
Now
cares.
look, fingers crossed, nothing's going to go pear-shaped. But,
I've been busy doing some admin. Ow.
Good
ow,
girl.
And I've got to get back to it.
excellent. Admin's always a good thing.
No, it's not actually, but it has to be done.
It does, doesn't it?
Ugh.
Let's just power up the device.
You don't know how.
Yep, she's on. Right, now, little toe.
Little toe on that foot.
On which foot? That foot, which is your right foot.
Right foot.
Yes. Alright.
You cannot hurt it any more than what it's already hurting, trust me.
Right.
No, we don't need to do that.
Oh, yeah, we do.
No, we don't need to do that.
Well, the reason why I'm doing this is because I'm concerned that your
No.
blood pressure is not strong enough to actually pump at the moment, and that's what's causing part
Oh
of
my
this.
goodness.
Out goes the arm. Around goes the wrap.
Oh man, that's
going to be a
aggressive.
gentle little
I've
hack.
already- Do you know I hit that elbow on my
Oh, she
bathroom
did.
cabinet?
She just went to the toilet and I heard this resounding
Oh, the
whack.
fucking
You know
bit.
that sound? That sound that you go, ouch.
It really hurt.
Shh, no talking while we've got something reading. Oxygen stats are at 96, heart rate's at 66. I'm going to rub your toe in a moment. Nope, the battery, this Omron blood pressure monitor, really good device actually, by the way. It's used in most GP practices throughout Australia. Has a low battery warning, so it'll give me that. Also gives me an indication if the cuff is not on correctly. Does a lot of really useful things. Just want to see what's happening. Dyan's relaxing, which she finds incredibly difficult to do at the best of times with her ADHD.
Ah!
Okay,
Is it over?
it's over.
Right.
Right.
Ah, little toe.
What's the bit? Oh, there you go. Now, Dyan's normal
I
blood
already
pressure.
know.
We need to understand what baseline is, and then we can make a determination from baseline. So 90 over
Toe.
60 will be her baseline blood pressure.
Toe.
We're getting an 85 over 58, and the heart rate's at 69. So she's 5 points lower than what we expected.
Oh, dear.
Now, she has also just
What have I
been
done wrong?
sitting up. So part of that exercise of why I got her sitting on the end of the bed, apart from trying to get some draining of circulation to the legs, was to also increase her blood pressure, because by sitting upright with orthostatic intolerance, or POTS particularly, postural orthostatic tachycardia syndrome, it would normally elevate the blood pressure by about 10 to 15 points. So at the moment it's not. So that's a bit of a concern that we're not getting enough push around. Okay, where are you? What are you doing?
Okay. Can you really pull that toe? I really have. Just yank.
You want me to yank the
And
toe?
you do it alone.
Okay. Toe being pulled now. Oh,
And then my next
Oh,
to it. just
next to it?
make sure.
next
No,
to it.
the next to it.
Okay, so there's no subluxation, so it's not clicking through, which is a good thing.
Twisty twist.
Oh, we do a
No,
twisty twisty.
Violated. violated.
Okie dokie.
Oh my god, you really left something in there.
I did.
You violated my ear hole. Ow, ow, ow.
Okay, taking your temperature should not be this much of a drama. Get over there.
Ow.
You are the worst patient ever. See? 6 times she sent me. Alright, so
I'm fine.
37.5. Touch is warm. 23.6. External temperature is 27 degrees. We're just going to make you a little bit on the cooler side.
What?
Yeah, because you're a little bit on the over hot.
Why is my heat pad on?
Don't know, but we're going to turn that off. And we're going to get that up and going. And bring your temperature down a little bit just to make you some cooler. We don't want you going into a febrile seizure now, do we? Alright, toes
Yes, please.
are here. They are attached.
Sticks.
Alright, so what are we doing with them?
Just, I don't know, wiggle the... Oh, don't take off all the cream.
I
The cream is
just-
helping. The cream is helping.
I
Put
know the
socks back
cream's
on.
helping. I need to be able to feel the joint structures better by touch, and I can't get that tactile-wise through socks.
Everyone's going to see my Flintstone feet.
Yabba dabba 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 doo. Your Flintstone feet.
They're too small.
Okay.
I wasn't blessed with length.
That's what he said.
Isn't it all but anyway, I'm not saying a word.
No, I'm tricking you to see
Starts
if you
with
are.
the letter G.
Alright, socks back on.
It's rude, sir.
If you wriggle your toes, how do they feel?
Really slow.
Okay, slow.
Slow.
Let's keep going with a
I
bit
don't
of.
think that seems correct. No.
Are we having a seam issue?
What's wrong with that seam? Why does
Okay.
it not feel right?
Okay, why is it that even the slightest seam deviation is not comfortable for an autistic?
Why do there have to be seams in socks at all?
Well, that's the thing. You should have no seams.
Yes. Is it the 1950s? Smartphones, dumb socks.
Yeah, something like that.
I'm just grumpy. I'm sorry.
That's okay. You are a bit grumpy today.
I'm very much in pain.
Send help. I'm blinking. SOS. No, look.
Send me help.
You deserve help. Dyan has been woken at. Are you
Okay.
having blepharisms? Is she having
Because
blepharisms? Spasms of the
I
eyes?
need a break from the dude.
Oh, you do not. You need a break from the people downstairs who woke us both up at 4
Yes.
o'clock in the morning, 6 o'clock this morning, 8 o'clock this morning.
Those nasty girls are being naughty again and not adulting. And they were
Yeah.
awake at 4 a.m. being stupid.
Yes.
Silly little girls. They're not even meant to be here. They're being evicted.
Yes, that's the problem. They
They're
have been
illegal-
evicted.
Illegal aliens.
Illegal aliens in the building.
Yes.
Well, we should
And
go
they
ring
like to be-
Ghostbusters.
they
I
like
don't
to
know.
be
Men in Black.
heard.
That's who we need. We need them in
They
the black.
like to be heard, right? And they come out of nowhere. They're like velociraptors.
Yeah.
They come out of nowhere.
Hence my concern
Okay,
for the
and there's
seizure
no
risk
logic
DEFCON
with these
5
people.
level because of the sleep disruptions,
There's no
the
logic.
stress levels
You
being
can't talk
heightened,
to them. because
pain
they're
response
stupid.
being heightened, and then GI
There's
tract stomach
nothing between
medications.
the,
She's got
the
all
two
the key
ears.
trigger items.
There's
that could
nothing in
lead to a
between the
seizure.
ears, right?
Mm.
I know. Sometimes God didn't bless us all. It's just the way it is, isn't it?
Okay. Now, no other changes to your symptoms body-wise? You're feeling okay?
Mac, or dressed in black.
How's your
black,
pain in your
silver,
feet going, honey?
Buttons, or down her back.
Honey, response required. How's your
What?
pain going in your feet? Are there any
I
improvements?
can't feel my feet
Oh, is that a bad sign?
after what I just
Went
Went
through?
through?
You're happy to have that.
Yes, I bloody well am.
Okay, so there's no
Are you
pain.
stupid?
I'm just kind of special, really. So, your pain is gone as far as the feet go.
Well, my feet feel sore.
Okay, your feet feel sore now.
Much better.
Not
than-
excruciating,
Absolutely.
screaming off the top of my head,
That's cold.
hitting your husband. I hope so.
I don't want it.
We're going to have it for a little bit. I just want to bring your temperature down a
The
little bit.
penguins are starting to migrate. I saw one jump through the doorway.
She's very, very dramatic at the best of times.
Okay?
You do
I
understand
saw
this.
a penguin and he said, "Hey, family, come in here.
This is not Happy
it's
Feet.
cold."
Okay, this is not a
It's
scene
all
from
that-
Happy Feet.
All the relatives are going to be here in about 15 minutes. His fault.
Well, I've got some ice cubes ready to go. Don't you worry
They're
about
going to
that.
shit all over the floor.
There's the OCD part. Right, other symptoms. Do you have any nausea?
No.
Do you have a headache or pain there?
I do have a headache.
Okay, how bad is your headache?
It's not too good, really. It's kind of painful, actually. I didn't really think about the head.
Okay.
It's actually more than my normal.
Okay.
It's not a migraine.
That's
it's a
good.
bad headache.
Right. You can see the process of trying to elucidate some information from a person who's got interoception.
Am I due for Panadol?
I'm going to give you some Panadol. I'm also going to give you a gabapentin at this point in time of what we've just been through.
Why is my tongue jumping?
Okay, because you might have a dystonia, you might be actually experiencing that in the movement of the rapid movements of your tongue. Eye, mouth, the whole lot is part of dystonia. Cranial, segmented dystonia. So let's turn some lights on.
My tongue's jumping.
Yep, that's part of dystonia, honey. I'm going to get you rapidly some medications. We don't need this progressing.
What medication?
Whilst you're able to swallow still, we're going to give you some pain medications.
That's a weird sensation.
Okay. Are you able to swallow okay for me? I'm going to sit you up a little bit more.
Taking?
You're going to give a Panadol
And
a gabapentin.
yeah, whatever.
All right. I'm going to also give you early, by a half an hour, 45 minutes, sodium valproate.
Yeah.
And a clonazepam, 2
It's
milligrams.
stuck here.
Have some more to drink, please. Good girl. Clonazepam will give us a muscle relaxant in case these
Brain freeze! Brain
spasms
freeze!
occur more so.
Oh, brain freeze!
Okay, come back to me.
No. Brain freeze, stop.
Okay, rub your head.
Told you the penguins are here. Penguins don't off.
I'll turn it up a little bit. How about that?
Off would be
No,
much
this
better.
is negotiating like a hostage situation.
Going down.
It's very
Turn
hard.
it off.
I've brought it up.
Turn it off.
I'm making it warmer.
Turn it
I'm going to
off.
reduce the fan.
I'm taking my hair out.
You're lucky. That's okay, as long as you don't remove all your hair.
No, I can't
Not the
take
time to
my
do that.
hair out. I don't have extensions.
Well, I was looking at the literalness of what you were just saying. You're going to take your hair out. You mean you're going to take your hair?
Well, some people do take their hair
Oxygen
out before
stats
they
are
go to
97,
bed.
heart
Did
rate's
you
at
know that?
62. If I have a wig.
Yeah. No, hair extensions.
Okay.
Okay, it's not our generation, but
Cool. Open. Nice and wide. Okay. So I'm not seeing any spasms with your tongue at the moment. Relax your jaw. Do you have anything across either transmandibular joints here? Do you have anything in your eye or underneath your eye feeling?
no, that was yesterday.
Okay, cool. All right. But your tongue's a bit of an unusual one for you, isn't it? Okay.
I'm fine.
You're fine.
I'm cold.
She's cold. Cold is a good thing if I can bring your temperature down just a tad for me. Oxygen stats are 97, heart
I've
rate's
got
55.
Lego to build.
We actually do
I
have
have
Lego
a
to build.
dream.
She has a dream. I'm ruining her
Let
dream.
me live my dream. I did a great speech, right?
You did actually.
Exactly.
Correct.
Stellar.
You have written a very good it's an
Thank
impact
you.
statement, which is what we're going
It's
through.
a stellar one,
Fantastic.
right?
Yep. Punch it out, girlfriend.
I just need you to grammatically
I am
fix it
grammatically
and then read it to
correcting
me.
it and fixing it at the moment. Yes.
Yeah, I need a bit of help with that.
Yeah, that's okay. And Miss Dyan's actually self-taught a lot of the way. Gone from a person who didn't get through high school with a primary school level
I
attainment,
ended high school with year 7 level education.
if that at best, but then went on and with help of tutor, did TAFE and then went on to university and exceptionally very good. But with all this neurological stuff that's become later onset with
I'm
22q.
losing things.
And as the neuropsychologist would say, she's losing memory, the ability to store that, retrieve that, executive functioning. The dyslexia has become worse. The stuttering, word finding has become
Even
worse.
long-term memories you lose.
Yeah. But luckily, so far, I'm seeing you have very good recall for long term. It's in the moment, short term. Dyan also has a hemisphere issue. So, for example, with the CDT, the clock drawing test, she would actually put all the numbers 1 through to 12 on the right-hand side of that hemisphere. No relevance to the left hand for positioning or size or understanding spacing or positioning.
Okay, my neck is not in.
Okay, next not in.
But that's just to turn that
I've
off.
turned that off. You want me to lengthen your neck?
Later.
Later, I can put you down here and lengthen it if you like.
Later.
Later, Gator? That's fine. How are you feeling at the moment, though?
Now you just made me aware of this massive headache I have, and I'm really ungrateful for that.
I'm sorry for making you aware. It would be nice to
Because
know.
it's left me in my own little world. How come all my life everyone just tries to get me out of my world?
Out of your bubble. Now,
Yeah.
blood pressure can
Where
also
my
be a
bubble
contributor to
Get out
pain
of
in
my
the head.
bubble.
But commonly we see this with the neurological, and obviously we've seen some Tourette's and tic type activity going on. So again, that's where I think a lot of the head pain is coming on. So we're covering all bases. She said her neck's hurting. She does have CCI, cranial cervical instability, which is a common thing again seen between 2Q patients. Why are you doing Marcel Marceau the mime?
My bubble.
You're in your bubble. Your bubble girl.
I'm in my bubble.
If I get a pin and I prick
No,
your bubble.
no one can get through my bubble. I have superpowers.
Good girl, I like that. Superpowers are so important. Now can I have a look? 96 and 59. Great. I like that.
Boom.
I just want to get your head down. Do you need ice for your head?
Can I put it on this finger, please?
Yes, you can. That's fine.
Thank you.
Would you like an ice pack for your head?
No.
Okay, good. I'm glad you said that, because at the moment I'd actually feel that would probably trigger you into having tics and seizures.
My legs are stuck going.
So one of the things that would normally use for maybe a headache, most of us commonly, if I had a headache, I'd put ice on it too. But in this case, it's not going to actually help.
For me.
That's one of your tics, by the way. That's you've got the whole nose thing.
For me.
Yep.
I will probably shoot my legs out and
You
clap.
probably would.
So I'm not doing ice.
And it probably leads straight away into more either
I think
severe
my
Tourette's
hair
or
is-
a seizure.
What is wrong with my hair?
So the medications I've given done
I
early
look like
at 5:30
Hermione
rather than at
right
6:15.
now.
You do look like Hermione
What's
actually.
going on with my hair?
It's one of those
Maybe
hair
I
days.
didn't put enough conditioner in last wash. That's
It's looking
probably
quite
what
nice
it
here
is.
though. So is it that, or did you tie it up slightly wet, slightly damp?
I have no idea.
No idea.
The
Muffins.
days are blurring. I'm so tired.
She is quite tired. This is unusual. Dawn's actually requested a second blood pressure reading.
I'm concerned. I don't want to have another event.
Do you know how hard it
so-
is to get her to even get a blood pressure test?
When my heart
Seriously.
event happened, I was the
Please.
first person to say hospital. So it takes a lot, but it does happen. Goodbye.
Now, no talking during this, please.
No talking during this, please.
See what I have to put up with? It's probably the quietest time in my life when we get to take the blood pressure, because she can't talk during that. I saw that 30-second period. Peace for serenity. I can hear butterfly wings. It's so quiet. I'm so mean. Waiting quietly and patiently. She doesn't do patient well. Should use that reference for her when we're talking about her patient. ADHD is like a contradictory term. Just saying. Alright, waiting for the results to appear. Right.
And
We've got an improvement. She's gone up
Yay.
10 basis points effectively, 94 over 65. Heart rate's
is
back
that
to
my
58.
normal?
So, for where you're at the moment, I'm happy with that with an increase.
Yeah.
I'm hoping that the
Get that off.
medications will kick out with the pain. Now, pain response may actually increase her a little bit further as well.
So
But
I
that
get the-
ketamine cream has really helped your feet,
Yes.
hasn't it?
Oh, it's
Bees knees, pain
bees
is gone.
knees.
I
But
like that.
basically,
You
guys,
don't always have to bring that one out.
this
It's a rarity.
is not something that just happens like because you've now just seen it. This like rarely. This happens all the time, but I don't show all of them. But obviously, he decided to show this one, and I'm glad because this is what we deal with. So anyway, you don't always see them, but that was fun. Not.
No, it's not actually fun. Now, remembering, we're not medical professionals, so any of the information and advice that
We're
we're
just
giving
going
you
through it.
is actually just showing Dyan going through the
This is
process
just my
of dealing and
life
managing
with
with
22Q.
22Q. If you need medical
I
advice, go
know,
and see your
Jazzy.
primary care physician or
Crystal.
specialist.
Take
So
care.
that's the disclaimer parts out the way.
I gave my budgies a
Your-
cup of coffee.
No, you did not.
I did.
Let's recorrect this.
No,
So,
it's a cup of coffee.
okay. So
It's a
up the
cup of
top
coffee.
here is a
Cup of
coffee cup.
coffee.
That's the
And
two
Jazzy
budgies.
loves it.
But that was the
Jazzy wouldn't even let
cool
Chris
thing
off.
Yes.
Jazzy wouldn't even let Christoph play with it. So
Right.
she was playing with it, and she grabbed one of the ropes. She was tug-of-warring it like.
Oh, was she now? So she was dominating
and I
the
was
new toy.
Oh, that's so cute, Jazzy. And I clapped and I praised her.
Right,
a bit of
as
like,
you do.
bit of like
Pavlov's dog,
stuff.
reinforcing, but they're
And
birds, not
then
dogs.
Christoph was like, that looks cool. I want to have a go. He tries to get on it, and she's like, at him.
Right.
I know, at his foot.
Wow.
And I was like,
bitchy.
Jazzy, that's nasty.
Antisocial behaviour, Jasmine.
Antisocial behaviour. So,
Budgeriguards are Australian parrots, by the
Jazzy,
way.
has he had a turn yet? Blink once, if it's true.
Not much blinking going on at the
He
moment.
should just blink.
Our birds
He's
are
had
with
a
us
turn.
most of the
But
day. In
she's
fact,
bossy.
we're around a bit of a menagerie. We've got the goldfish that are
Is that
located
normal for birds
just
to be
over
bossy?
here. We obviously have William, who's in his little cat thing over here.
sleeping.
And of course we have Dyan, the other animal in the menagerie, aren't you? You're the zookeeper.
Hi.
Feels like a bit of a zoo, actually, doesn't it?
I tried to find a tree,
Frog?
green tree frog,
Mm-hmm.
and an enclosure, but too difficult.
Yeah.
So I'm very, very sad, but happy for the tree frog because it's one less tree frog that I'm taking from the wild. But anyway, I used to get them in Denmark and I used to hold
A little
them.
country town down south.
And then I'd put them
of
back on the
Western
trees
Australia.
because they used to got these big, tall, thin trees.
Yep.
And I really miss them. Not them waking me up in the morning. No, the croaking is rather annoying
Right.
because it goes on from
Dawn to dusk. And
yeah.
actually,
I mean,
most
they
of through
normally
that because they're
start
quite
about
nocturnal,
midnight.
really.
They
Yeah.
normally start about midnight.
Yes.
And they go right through. But then again, that was nothing compared to my hobby farm was like backing onto an actual farm.
A cow's
And it
for
was where the
milking
cows were, so I could hear my friend's dad with his radio
at 4 a.m.
and
in
the
the morning.
cows going, "Hoo," 'cause
Is
they're all
that your
getting
moo?
milk.
Is it? Is that a moo?
Well, it's probably very painful for these cows. These cows do a lot for your milk.
They do.
Salute them.
Salute the cows and salute the farmers as well. That's
Because
right.
getting milk just must be a painful process, right?
Yes, indeed.
Yeah. I
Right.
couldn't even do it.
Oxygen stats at 94, heart
Like, I
rate's at
couldn't do
68.
it.
No, you,
I was
you
unable
couldn't
to
do
do
it.
it.
But that's part of having
But I'm
your
just
type of body
saying,
with
like,
22q,
that's for us to
unfortunately.
wake up to. Was like, must be nearly ready for school time. Because we had to be up at the road by 7 a.m. for the bus.
For the school bus pickup.
Yeah.
And if you miss that, well, that's a long
Country
walk to
towns.
town, isn't it?
Yeah, you've got to be up early.
Mm.
And when I used to ride my bike to the road,
Mm-hmm.
my hands would go, like, I would
From
try
the
and
ice.
ungrip them, and I'd be like, oh my
It
goodness.
is very, very cold in Denmark. Yes.
Yeah,
Bit
that's
dramatic.
with gloves on.
Mm-hmm. Now, you
It's not
seem
dramatic,
to be
it's real.
recovering, which is well. You're talking very nicely engaged.
My feet feel good.
The pain from the feet has now gone, so I'm happy campus there. I'm not seeing any tics or other sort of myclonus behaviours coming
Actually,
through.
about a slingshot.
Imagine, we've actually got one of those. Your tongue, is that feeling a bit better?
We've got a slingshot.
We do have a slingshot.
We get to play with it.
We can. How's your tongue now feeling?
Fine.
Okay, cool. So those symptoms are dissipated as well.
My whole body's been able to calm down
Calm
because
down.
the pain has
Good. Been
turned
managed.
into just sore feet.
Okay. And the headache, with the really strong, intense headache?
It's still there.
Okay,
the
well, I'm
medicine's
going
gotta
to
kick in.
wrap this up and turn the lights down to dim that
Yes,
down a little bit.
please.
Because I don't want to do ice, like I said before, because that'll create more of a tick reaction and go into things.
But guys, if you suffer, I don't even know what you call that
Intense pain.
intense pain.
Yeah.
And
Is it a
have-
nerve-related thing? Is it a
moments-
circuitry-based thing?
No, but just moments of your body doing these
Yeah.
things, and you just go through this. Could be half an hour. Sometimes it could be hours of just
Excruciating.
excruciating screaming
Absolutely.
pain.
It's
So
not fun.
I don't have many pain options, so
Yeah.
that doesn't help.
And look, if you're
But-
by yourself, it's not that easy. You can't exactly rub your own feet that well, or pull your
No.
toes, or do those sort of things that I
No.
perhaps have done for you.
And I
So
was
it does show the
struggling.
benefit of
I
having
was-
supports or informal supports or a partner around to be able to help in those
I didn't
sometimes.
even know what to ask for because the pain
Overwhelms
my
you.
brain.
So that's executive functioning does get totally
And
disarrayed
that's
during
why
that.
I slapped him on the head.
Yes, I love tap.
It wasn't in a like
No, there's
abusive way. It was like
It's a
in
reactionary response, I
yeah.
get you. And it actually is helpful for me because it does give me indications, all of these things. I look at
Yeah.
Diane's overall
If I
body
can't
language.
speak, I
Sometimes
have to
not
tap.
what she actually says, it's sometimes whether she's furrowing her
He can
brow.
read me. It's
I
creepy.
like a book. I can. I know you chapter and
He
verse.
reads me like a book, and it's like, how do you know?
You do need to get to know your own autistic person and help them through these sort of things, whether it is a pain or a seizure or a neurological event. Well, guys, like I said, we're going to wrap up there. Hopefully, Dyan's okay for the rest of the evening and night.
Okay.
You're tired. I know that. I expect that. But early bed tonight for you.
I am
And there's the first
tired.
of the yawns.
I'm very,
Guys, give
very
us a big thumbs up.
annoyed
If you've
at
got
my
comments,
neighbours,
questions,
but
suggestions,
they will be gone soon.
leave them below.
I know I keep
And if you're new to
saying
the channel,
that.
don't forget to subscribe.
It's
Hit that
Bathgate,
notification bell.
Neighbourgate.
Yeah.
Okay, we've
It
got
is.
Bathgate, Neighbourgate.
Oh, don't even go there with the bath. The bath.
Wish me
The spa
luck.
bath. The disabled walk-in bath.
See, you
That
know
would have been
what
so
he
helpful
would have
right
done
now.
in this situation is he would have put me in there.
Yep, I would have.
And the circulation would have got
Circulation would have warmer water opens up the capillaries.
And the bubbles.
jets opens up.
pumping. Yep. So
You
anyway,
can see the benefit, and we're still waiting. Nope, don't know when.
wish me luck, guys.
2.5 years. 2.5 years to get a
because
bath operational. Still haven't got it done
I don't like having a shower
in this condition.
in this condition when it causes chest pain, when
You're a
everybody
false
knows
risk
the
and everything
chest
else.
pain.
Yeah.
You know where that can go.
Yep.
You have to be careful, right? But yet you have to be hygienically clean to be healthy. So it's part of your, as a disabled person, as a human person, part of our healthcare is hygiene care.
Mm-hmm.
End of story.
Absolutely.
And everyone has the right to be clean.
Yeah.
But the problem is, in Australia, it's not that easy to get the supports you
Or
need
getting
from
the AT, the
NGIS.
disability supports, the equipment you need to actually help and enable
My
those
provider
things.
did this bath for me because
Yeah.
they're ethical and they
They care.
actually used to work in disability.
Yep.
Now they work in the housing type side
Full
of it.
disability.
But what that means is they know what you need.
know the
They know
system.
how you
They know
have
the
to
people.
live. They're not just some absolute stranger who's
Yeah.
just an investor.
We're
So
disconnected from
it's
it all.
very, very good.
Indeed. All right, guys, thanks very much for watching today's episode. We'll see you soon.
Bye.
Bye for now.